Thank you. Good morning. Following on Carmela's wonderful presentation, we'll be addressing affordability in a slightly different manner, talking about consolidation and M&A in healthcare. And as you'll hear through some of the case examples we'll talk about later on, the public presentation and the communication to the regulators about some of this consolidation has been that it would save customers and the system money by this consolidation. That, of course, as we'll talk about further, is debatable, and there are certainly different opinions about that, but there is certainly a connection with the question of affordability to this talk as well. I will also point out that the slides in your app are much more detailed, so you don't have to be taking notes unless you want to. I want to start with giving you just a global overview of M&A transactions and how healthcare is a part of that. This is M&A as a whole around the world. In 2019, there were just under 50,000 transactions. That was actually slightly down from the year before, where there were just over 50,000 transactions. The dollar value around $3.9 trillion. You'll see that the United States makes up just under a quarter of these transactions. And when you look at these various locations around the world, you'll see the only one that had a slight increase in 2019 was mainland China. So it will be interesting to see what happens in 2020 with what's going on there. The healthcare sector, along with technology and energy, have been the most active sectors for M&A. For healthcare specifically, it was $533 billion in 2019, which again, bucking the trend of the overall global perspective, was actually up 26% from what we saw in 2018 for healthcare. 8 of the 10 biggest deals were in the United States, and the number one largest was Bristol-Myers Squibb acquisition of Celgene. That was a $74 billion transaction. Now, one thing you'll notice as we continue on and talk about the top healthcare deals of 2019 is some of this terminology ends up categorizing certain things in a different way. So Bristol-Myers Squibb is not on this list because it actually gets categorized as life sciences. And so here, talking about the top healthcare deals of 2019, the other thing to point out is that the classification of the year can be different too. CVS Aetna, which is noted to be number one in 2019, was also noted at the top in 2018. And as we'll discuss this particular transaction in more detail later, it's in part because the CVS Aetna deal was reported to close in November of 2018, but then because of some regulatory questions, it didn't actually finalize until 2019. So it actually made rank in both years. The second largest deal was the $29 billion merger of Dignity Health and Catholic Health Initiatives, making it the largest Catholic health services organization in the United States and the second largest nonprofit. The largest health system is HCA, and the largest nonprofit is Ascension. This merger of Dignity and Catholic is now called Common Spirit, and they are now a $29 billion organization that has numerous hospitals across the United States. The third largest deal is the Centene WellCare, managed care organizations, and this is a $17 billion deal that resulted in these two organizations now having managed care presence in all 50 states in the United States. So it really makes it a very large organization serving 24 million members. In order to appease regulators' concerns about this deal, there were some divestitures from both of the organizations, as is often the case with these M&A transactions. Among the themes that we see in these recent activities is that there's been a goal of identifying synergies that particularly enhance population health and data analytics and consumerism. So, and in consumerism, I mean, appealing to the desires of the patient, access, convenience, a lot of what we just talked about in the earlier session with digital health transformation. The increased scale is a huge focus, and this is where the idea of affordability is often introduced, that by bringing these organizations together, certain costs can be cut through greater efficiencies. And as you'll see, sometimes that's the case, but not always. And then finally, expanded control across the care continuum. So many of these transactions are vertical, so that there's additional scope that is achieved when the two organizations come together. Focusing in specifically on healthcare services, primarily provider type organizations, you'll see that in 2019, that clinics and outpatient services had the largest percentage, both in deal count and in deal flow being the dollar value. The other large players are in practice management, hospital and inpatient services, and also in elder and disabled care. So going into a little more detail about some of these recent interesting mergers and acquisitions. CVS Aetna, as we noted, one of the largest over the past couple years. CVS acquired Aetna for $70 billion. They originally reached agreement in late 2018. But you know what one of the largest and most vocal opponents to this merger was? Does anyone know? It was the American Medical Association. They invested huge amounts of dollars and time bringing 4 experts together in numerous hearings and papers to oppose this. They argued, the AMA did, that this would bring higher costs, reduced affordability to health care. CVS Aetna, on the other hand, articulated in their press releases and in their presentations before the regulatory bodies and the judge, that this would actually bring cost savings through merging the insurer with the provider of pharmacy benefit plans and with the retail clinics. So there was multiple months-long debate, and ultimately in September of 2019, the judge did agree to let this transaction go through with the one requirement that CVS divest its Medicare prescription drug program. The AMA subsequently came out saying that this was not enough, that they still had significant concerns that this would bring higher costs through less competition among the insurance markets and the pharmacy benefit markets. So let's look ahead now to where we are. Just last week, CVS released its fourth quarter earnings, and they certainly pleased the shareholders. They pointed out that particularly their retail sales were up 3%. So perhaps that is more traffic into their retail facilities because of the members through Aetna and the greater access for their prescriptions there. It resulted in the actual gross profit within the retail centers going up 79%. And then similarly, the sales across the entire organization, which had been projected to be about $64 billion, actually came in at $67 billion. So again, shareholders were very happy. It's probably too early to tell whether the efficiencies that CVS Aetna has gained have been passed on to the consumer or not. Certainly, there are some concerns about the impact this will have on the smaller pharmacy and whether they can compete in this market, and the other potential benefits, however, is argued that this arrangement will help reduce unnecessary utilization within the hospital in the ED, because CVS, having the minute clinics and an overall goal, they've actually said to expand services within their retail centers to bring more care outside the hospital and into this community setting. So it kind of, again, raises the question about what impact will this have on hospitals as well, with other non-hospital entities getting into the healthcare provider market like this. Another effort, certainly focused on bringing more affordability to healthcare, is Haven. This is a group that was formed by Amazon, Berkshire Hathaway, and JP Morgan. Right now, it's an offering exclusively for the employees of these organizations, about 1.3 million employees here. And this was an arrangement that was announced in January of 2018. And since then, they have been working to reduce healthcare costs through different ways of with Amazon bringing more technology and all of the organizations coming together to make healthcare more transparent and to provide a stronger, larger negotiating power with the payers. And so, here, when you think about who are the potential winners and losers, it's potentially additional organizations that will help reach the goals that Haven has. So some of the digital health providers that were talked about in the last session, I could certainly see some greater collaboration with those organizations to try to make healthcare more affordable, and again, take aim at the hospitals and those higher costs of care within the hospital walls. There's also some speculation that this is a pilot study for a larger effort, and that while right now it only serves the employees of these three organizations, that certainly Amazon may have goals of taking healthcare to its broader customer base. So it'll be interesting to watch how this collaboration unfolds. Advocate Aurora came together in spring of 2018 to become the 10th largest nonprofit health system in the United States. And they have also promoted that they are bringing efficiencies and cost savings by coming together. And they have said that they want to grow from their current $12.8 billion in revenues in 2019, which by the way was up from $12.2 billion in 2018. They want to grow by 2025 to $27 billion. And they have a much broader market perspective. They're based in Wisconsin and Illinois, but they say they want to serve a patient base of 10 million patients, and they look to be expanding this. Now, it's interesting, when Advocate and Aurora first came together, they said that they were going to have co-CEOs, and for the first few months that was the case, but sometime thereafter, it was decided that the Advocate CEO would take full reign and the Aurora CEO was out. Each of them were paid somewhere in the range of $11 million a year. So presumably there were some cost efficiencies gained by reducing to one CEO. But again, the question of, is the savings being passed on to the patients? Certainly it's been promoted as a way to bring greater, higher level quality care to the central US. And to provide greater negotiating power with the payers. And one loser, though, clearly that has come out in this is that advocate employees had previously, for decades, anticipated an annual bonus. And after this merger, one of the cost efficiencies that was implemented was an announcement that they were cutting this employee bonus. Now, the public reporting on this says that these were relatively small bonuses for most employees, $100 to $300 per year for these frontline staff, but a substantial amount for them in their overall budget planning. So, this was something certainly that has been a negative in the press, and I don't think this was probably the best way to cut costs, and probably didn't save a whole lot. You have to wonder what impact it has on overall employee goodwill and community goodwill. But that was one of the things that happened there. And then, so we'll move into just talking a little bit more broadly about how care looks to be moving. M&A is certainly on the rise. It seems like systems are getting bigger, and when we look at these deals, the focus has often been more on scope than on scale, so expanding the overall service offerings rather than just adding to existing service lines. Within healthcare specifically, where the deals topped $1 billion, 74% of these were considered to be scope type deals. Looking at the private equity market, which often provides some forecast of where the healthcare innovation and investments are going, hospice and health tech seem to be the hot markets for 2020. And these also, you could say, play into the affordability aspect, with hospice being a way to reduce costs at the end of life, and there being a recognition that various CMS regulations may expand coverage in this space. Under health tech, again, as we talked about in the prior session, there's a recognition that if health tech can bring value to healthcare, that there will be interest in greater reimbursement for these type of technologies. Along with the discussion on technology, I think it's important to recognize some of the risks, and cybersecurity was mentioned in the last session, but also it's about the image that the organization is portraying. So there was an article in the New York Post in early February about how doctors and nurses and their organizations are increasingly turning to social media to promote their brands, to sell products. And sometimes it's being done appropriately and being done well, but other times it's bringing negativity on the organization. And in one example in this article resulted in a physician being fired because he or she had PHI that either inadvertently or accidentally got released into the social media. So healthcare organizations, hospitals, and provider groups are in a situation where they increasingly have to engage with social media, but need to figure out how to do it safely and effectively, and use it to improve the consumer experience and not bring risks on the organization or dissatisfaction to the consumer. So finally, I'm going to close with talking a little bit about a survey that my organization BDO conducted in the last few months of 2019. We surveyed 100 CFOs across the country in hospitals and other large provider groups to ask them about their perspectives on the healthcare market for 2020. And you can access this survey in full at the link provided here. It's clear that CFOs have growing concerns about the overall economy and the healthcare market specifically. Of these CFOs surveyed, 55% anticipate that a recession is coming in the next 2 years and that this could impact their business. And there is some correlation of those recession fears with what their projections are about their own financial forecasts. Overall, things look fairly rosy. You see the majority of CFOs actually expect that there will either be no change or as much as a 25% increase in their revenue and profitability. Among the market triggers that are likely to put a strain on providers, the potential recession and the ongoing changes to reimbursement models are a great concern. 23% said that they're most concerned with risks related to government reimbursement. 76% of those surveyed said that they have only 60 days cash or less on hand, and they're concerned that this could be further strained by the instability around the Affordable Care Act and the increased expenditures that they have to lay out for enhancing their electronic health records, and then uncertainty around incoming revenue as models are changing. And we talked a lot yesterday about how even patients who are well insured have increasing deductibles and coinsurance, and that this is resulting in some higher bad debt levels even among those that are commercially insured. And as I mentioned, there's some correlation about the recession fears with cash on hand. So among the 32% of providers that have less than 30 days cash on hand, 69% of them anticipate that there'll be a recession in the next 1 to 2 years. Among the 44% of providers that have 31 to 60 days cash on hand, 52% expect a recession by 2021. But for those who have 61 or more days cash on hand, less than half think that there's going to be a recession. Looking at the healthcare's top investment sources, I'll point out that 22% anticipate that they're going to be pursuing M&A. So again, to highlight how this is really a top area of activity among healthcare providers. 36% anticipate that they're going to undergo some restructuring in 2020, and 42% of CFOs say that bank loans and lines of credit are still their largest financial obligation. So in closing, I'll point out that among the many ways that you in provider organizations can make the most of the current healthcare market is to consider transactions. There's strategy and transformation, a focus on value-based purchasing, improving your operations and performance, reducing your risk, and considering restructuring and turnarounds. But transactions certainly are growing, and we anticipate that there will be more of them as we discussed today. And I thank you for your attention.